Hello and welcome to the Government Information Unit radio program. I'm Mike Jarvis. The GIU radio program is on the air on ZJB Tuesdays at 7:06 p.m. with a rebroadcast on Sundays at 1:30 p.m. You can also listen back online at www.zjb.gov.ms and also on our Spirit of Montserrat Facebook page. This program, the Government Information Unit radio program, is about the services, programs, projects, policies, and events of the Government of Montserrat, the public service. In this edition, we bring you the second of our two-part special focusing on the delivery of healthcare services via the Ministry of Health. Taking part in this program are the Honorable Minister for Health and Social Services, Mr. Colin Riley, the Permanent Secretary in the Ministry of Health, Mr. Elijah Silkett, and the Director of Hospital Services, Mr. Terran Gilchrist. The effort to provide as far as is humanly and economically possible the healthcare services that the community needs. But there are some services that, for purely economic reasons, we are unable to provide them on island. And we've developed these partnerships with neighboring islands, partnerships with the UK, etc. Could you expand on that first?
Well, through the Department of Works and Pensions in the UK and facilitated by the Foreign and Common Office, we have 4 cases that we can access in the UK system through the NHS. And those are determined by a list of priorities that's developed by the Chief Medical Officer and her team with medical referral and the Medical Referral Committee. Once we get through those 4, we are looking to buy services. And that's where the Social Welfare Department comes in. Because in cases where a resident has a need that's costly, we can provide financing up front with a means test determining the level of repayment. So if you means test for 0 repayment, that's what you get. If you means test for 50% repayment, that's what we deliver. And if it's 100% repayment, then we will give you a payment package that's affordable. So there's that in place for you to get the care in a regional facility. It could also be in the UK, it could be in the US. What we have, though, is a system where the local doctor works with their counterpart abroad to deliver for you a care package that you are a part of. So the patient would also be involved in the conversation. The local doctor helps to guide the decision, and also the consulting doctor abroad would be part of a team. So we see it as a 3-way partnership between the patient, the referring physician here, and the receiving physician in the hospital abroad for you to access that care. That system is in place, it's working. We had some issues with the private hospitals in the region where the cost structure is very different from the public facilities. So we are now moving to set up memoranda of understanding with hospitals in Antigua, the public ones, in Guadeloupe, in Martinique, and in Barbados and Trinidad and Tobago. And St. Martin has recently said to us that as a fellow European overseas territory with a more highly specialized healthcare than we have here, that they're willing to provide the service. We are researching something we became aware of, where there is a fund in Guadeloupe funded by the European Union that has some capacity to help us, because there's a MOU between Guadeloupe and the Dutch OTs, Sabre, St. Eustatius, that provides that healthcare. So there's a lot going on around us. We are moving to be a part of it. We have people working on it on the administrative and negotiating side. I am also taking the advice from my professional staff, and we are acting to advise the cabinet and make it public policy, where those memoranda would become standard procedure that our people could depend on to deliver those more highly specialized services. So it is something that is active. The Ministry of Health's programs are very active. You've heard the higher level of professional presentation by the PS and the Director of Hospital Services, and there are others within the ministry as well. I know you just have 3 of us today, but there are others as well who can come here and explain what they're working on with more specific detail. What we have is a very strong team. Our team emphasizes exactly what I'm saying, the team approach. We work together, we've delivered a lot to the country, and we are working to deliver even more.
Speaking of the health team that we have, this team of professionals and the team approach into addressing the health issues of Montserrat, what would be the principal and recurring health issues facing the community, and how are they being addressed?
Sorry. With respect to the challenges facing the community, we speak of CNCDs, the non-communicable diseases, such as diabetes and hypertension. And we have been working hard on those particular areas. In fact, we have done health promotion, so much health promotion over the past 2 or 3 years that we have seen an uptake of people coming to the hospital for treatment. That is telling us that the message is getting across to the people. You understand? And that is important to us. It's costing us more. It cost us so much that last year we had to go to Parliament for a supplementary. But we have to pay if we are going to encourage people to be better off. So CNCDs, we are investing in them. We've also invested in our children, because what we're finding that the problem of diabetes, hypertension, are tackling people at a younger age. Now, this didn't happen in the past. Why? Because as children, you used to go with your granny or whatever to the ground. You used to have a sheep to look after, and so on. So we have a team now looking at different mechanisms to share with these children as to how they could be better off. The concept of play, the concept of walking, and the concept of eating. Because one of our biggest challenge among our children is that gravitation to corn kernels and those processed foods.
Well, not to cover, that's quite interesting, because in a society that basically is not a fast food society, where we have so many fruits available, where on this side of the island, I've always said, no matter what you do, you're going up a hill. If you're walking, you would have thought, right, that in terms of being healthy, that comparatively speaking, we should be quite healthy.
Let me tell you something. Don't you underestimate the value of the media, you know. There's a particular advertisement, I think it's a one, Buster. You ever hear Buster? And that drink pouring on that glass. Sounds refreshing. So children gravitate to media, right? What our team have been doing is seeking to make nutritional interventions amongst them. So we've carried them into camp, and we are training them how to use these products in a different way. You understand? That would, increase the nutritional value. Somebody might not want to eat a mango by peeling it because it falls on their clothes. No, you show them how to peel it, cut it up, mix it up, and then you have a fruit bowl. You understand? So those are some of the interventions that we are actually doing now, targeting our children.
What about, you mentioned hypertension, stress levels, anything pertaining to the volcano that is an issue that our health experts have had to address to that degree? Minister?
Well, I know 3 years ago when Dr. Fergus Rose started her clinic in cardiology, she did express a concern about the high level of stress and hypertension that she was recognizing on the island, which seemed to be out of scale with the population. And even though it's not something which is easy to attribute, I think there's something there for us to be concerned about. And I know that in the whole response to stress and the area of psychiatric services, that we have been doing a better job of providing first a visiting specialist and now an on-island specialist with supportive nursing care and also community care that is reaching out. We've done a program to house all the mentally challenged persons to make sure that they have the programs, community-based programs that give them that sort of thing. And now we're into workplace wellness. Workplace wellness is going to cover anything from HIV and AIDS all the way to concerns over stress and family relationships and those kinds of things. So we're giving our people additional tools, additional information. We're sharing and caring, and we're doing that work which has been promoted through our health promotion unit and other departments within the Ministry of Health. So the point we are making about the healthcare is not just about health and wellness. It has everything to do with our civilization, our nation building. These services are critical to our future, and we are insisting on the highest qualities in both health and in all the other services, education including. And just to put in, as I'm the Minister for Education, just to say that our schools, public schools, the government schools, are back performing at a very high level. And that's because of the intense focus on service improvement.
Thank you very much, Minister. Mr. Gilchrist, getting back to you.
I just want to mention one of the challenge faced, and it's not only for Montserrat, it's many Caribbean islands, is that we are noticing a demographic, what is considered to be a demographic transition, in that the population is getting older, and in Montserrat we have roughly about 21% of the population might be over 60. So you just could imagine in the next 10, 15 years, and that's a major challenge. So the question is how do we provide for the older folks? Our vision is providing care from the womb to the tomb. There should be no disparity in the quality of care provided to a child and to someone at 90. And this is why we are building a hospital that can meet international standards. We are building a hospital that can be matched with the NHS standards. We are building a facility that we all can be proud of and can cater for all persons with regard to safety, security, serenity, and respect for the individual. And we're also training our staff to deliver that level of care. Interestingly, I want to mention that one of the things we are doing in ministry now, we are looking very intensely with the quality of our Medivac system.
And by Medivac, that's medical evacuation.
Medical evacuation. And that review is being done by the CMO. We want to make sure that our Medivac system can be matched with any other system across the world, simply because we are limited in terms of some services and we may need to evacuate persons overseas. And that program, in the next few months, you will see an establishment of policy, standards, guidelines, and training, except to make sure that we equip in such a way that something happens on this island, we can get someone off the island as quick as possible. With that, the establishment of the MOUs in the receiving hospitals, as the Minister and CMO, as the PS spoke about. That is an important service that we want to ensure. We want to ensure that people are secure on the island, that anything happens, we have the system, we can respond to that. So I just want to mention that. That's an important area of the ministry's intervention.
Right, thank you very much. Mr. Silkett, you were making an intervention as well?
Well, I wanted to share in terms of how we continue to deliver high quality care. In my opening statement, I spoke about getting human resources as part of the Ministry of Health. So far, we have recruited high quality CMO. We have Mr. Gilchrist here, who is the Director of Hospital Services. That is new. That is recognizing that when they're asked about how are we going to do this project, while you're continuing your job, we said we need assistance because it'll be difficult to do the operations while also dealing with the project. And thus we asked for technical assistance, and DFID provided it, and as such Mr. Gilchrist is here. But apart from that, we have also recruited a clinical psychologist, and that is to fit in between the psychiatrist visit every 2 months. But in between there's a need for us to talk to someone. And as such, we have that person in place, providing high quality care to our people. We are investing in our children. And so therefore, as of 1st of August, there'll be a child care specialist be part of the Department for Social Services. This morning, we started recruitment or shortlisting for the senior social worker. So we have to say it's the Ministry of Health and the Social Services. We are not only equipping the Ministry of Health, but also equipping the Social Services Division for them to carry out their work. And very soon, we will have a community mental health officer. You know, we have a lot of mentally challenged persons in our community. They're there, and we appreciate them, and we are part of us. We think that they could work. We think that there's more value to them than sitting at Lime or at the gas station, as the case may be. And as such, we are now recruiting someone to develop programs for them. Maybe it's to do a piece of land and plant some food to feed themselves. Okay? Maybe it's to make baskets and sell. But we are tackling that particular issue by recruiting someone to deal with that.
Just on that point, and for the purposes of this conversation, you spoke about what some folks might probably consider for a small community population of 5,000, sort of a inordinately high number of mentally challenged people. But should the point be made that we have people in that circumstance who might have been unable to leave the island when other people were leaving the island? So as a result, because so many other people left, they remained, so it looks a bit out of sync. But it's not to say that it is an increasing number. It's a static number, I take it.
It's a very static number. We have not had new cases. These people has always been there. In the past, they would have been distributed in the various villages, in the east, in the south, in the central corridor. Now they are concentrated. So it looks like an inordinately high number, but we recognize that one of the challenges that we had with the volcano. It's similar to what happened to elderly care. A lot of people left. So that's why we now have 3 homes. We have the Lookout Award and supported area, we have the Golden Years home, and we have the Margetson unit up there. And that's because people who had to travel to take their children to school left their elderly ones here. And as such, we have them to deal with and care for at this particular time.
Right. Gentlemen, thank you very much indeed. There's one note that I would like us to address, well, sort of two. One has to do with something we haven't touched on at all, and that is public health, environmental health. Where does that fit in within the scheme of things?
Okay, environmental health, like I said to people, that the health spans from the New Windward dump site to the Salem Clinic, right across the country. So, and in it, that's environmental health is there. You know what? Montserrat is so clean. Everywhere you go, or when people come here, they said, this country is so clean. And that's a result of the Environmental Health Department ensuring or contributing to ensuring that the guts, the sideways are kept clean and clear. They are also very, very much involved in prevention strategies for chikungunya. Every now and again, the guys from the environmental health unit, they're on the port, spraying, fogging, because we consider Montserrat a unique place and we would want to avoid chikungunya and malaria. So the environmental health unit is actually working very, 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 very hard. So notwithstanding sometimes they're not in the highlight or not in the forefront, they're actually working and they're keeping us healthy.
And the final point for me that given the work that is being done by the Ministry of Health and the Ministry of Health and Social Services in terms of delivering primary and tertiary care and the environmental services to and for the community also has a responsibility to itself. Individuals also have a responsibility for their own health care and health maintenance.
The point was made about the impact of the media. The PS spoke with some clarity on the relevance and importance of media messaging and our interfacing with people at different points, letting them understand that health is in the workplace, health is at home, health is in the church, health is in community. So we are seeing an increasing wave of people who are taking healthcare very, very seriously. The information flows that we are seeing, though, tell us that some people do not understand the service that well. In terms of, sometimes you meet people, like I meet people because I'm the constituency representative, and they would say, oh, I have a problem. I say, who is your physician? That's my first question. Because I know once they start working with a doctor, the entire service opens up to them. And the range of potential that we have developed for dealing with and treating with conditions for patients is available to anyone and to everyone. So that's why I would say to them, who is your doctor? Is it Dr. Bufong? Is it Dr. Gopal? Is it Dr. Perkins? Go back to your doctor and ask them to begin a referral on your behalf. So you can be referred internally, locally, or referred abroad based on the condition. So it's for people to understand that care potential is there, locally, and also for them to be referred regionally. But we are working to keep more of the business here. Because as we expand our capacity and increase our capability within the hospital and with our visiting, some of whom are timed visiting specialists, some of whom are periodic and we know when they're coming, we can program patient care within a more manageable way so that we can manage the cost that the PS introduced, or the $2,800 that he spoke about, which is the average expense for a simple procedure. We could probably do it here for $400 or $500, and the government would pay a portion and you would pay your portion, and that's the way to manage the healthcare finance. So this is all about making sure that people understand. You have a responsibility to yourself to check your weight, to have your annual visit, to make sure that you understand the importance of diet, the consumption of water relative to other drinks, how you're going to deal with the sugar beverages, the Coca-Cola stuff that some people like to talk about on the internet. I know a lot of people have read or have looked at the lecture Sugar the Bitter Truth, which is a viral video. And there is so much going on in terms of how people are responding to information. So people do have a responsibility to themselves, yes. Patient compliance, that's another big area. When a doctor gives you a medical diagnosis and a treatment, compliance is virtually required if you don't have a second opinion. You have a right to a second opinion. But I have seen very, very bad outcomes as a response to poor patient compliance. And I want people to understand that under the sound of my voice. Please, if you don't believe in the recommendation, seek a second opinion. And when you get that second opinion, please follow the recommendations of your physician, because the patient compliance is critically important. If you're put on a weight loss program because your knees are bad, if at the end of it you refuse to follow the recommendations, the CMO has already promised me that she's not going to give you knee replacement surgery. These are some of the harsh choices that we are going to have to face, because there are ways for us to avoid some of the negative outcomes. And that is why we are speaking so specifically to people at this point. Sometimes we have to prevent the expense by following the recommendations of our doctors.
And lifestyle choices as well figure in this, lifestyle diseases we spoke about, diabetes and so forth. So really, your health, in as much as it's up to the Ministry of Health and the government, your health is really your responsibility.
That's right. Like I said, this program is part of our communication strategy to ensure we get the work of the Ministry of Health out there. As the Minister said, sometimes people don't fully understand what we do because we do so much. You understand, we are so wide. So we are trying to ensure that people appreciate the work that we do. But they too have a responsibility. For instance, you hear a program called Talking Health every Wednesday that speaks to how people care for themselves. The challenge would be the patient response, the patient taking responsibility for their own health and their own well-being. And that is what we would like to get communicated across. People have a responsibility to themselves. In not as much as what the ministry is doing for me, is what could I do for myself to make myself more healthy. That's important.
Mr. Elijah Silkett, the Permanent Secretary in the Ministry of Health and Social Services. And that ends this edition, this two-part special, and this current series of the Government Information Unit radio program. We may have special editions in the coming weeks, but the core program is taking a break for now. I am Mike Jarvis. Thanks for listening.